The one thing that I think all of us are really talking about is the fact that we want to be in control until we can't be in control. So I'm up here representing hospice. Hospice is one of those terms that nobody wants to hear because you think that we're going to come in and we're going to make things change. Our motto, our mission statement is that we are here to journey with you to have the best of life until the end of life. So with that motto, we're saying if you have been to the doctor and they tell you that you have a terminal illness, an illness that is going to eventually take your life, then the question is what are your chances? What are you going to do? A lot of times people don't think about the questions that they need to ask. What kind of questions do you need to ask about so that you still remain in control? They tell you that you can have treatment. Okay, how long? What's my prognosis without treatment? What's my prognosis with treatment? You need to ask that question. How sick am I going to be if I take this treatment? Is it going to be worth it to go through that if it doesn't extend my life as long as they expect it to? What's that going to be? Or do I just want to be kept comfortable, stay at home for the most part, and have my children and my family around me? The question comes about is, where do you want to go? What's the best plan there? So let me tell you a little bit about hospice care, what hospice is. Hospice was started over in England, and the first modern hospice was started by Dame Cecilia Saunders. And her motto was, you matter to the last moment of your life, and we will do all we can not only to help you die peacefully, but to live until you die. And sometimes that means a whole lot to others. So our philosophy is that death is a natural and normal part of life, but because it is a natural and normal part of life, we don't hasten death, but we don't stop it from coming naturally either. So we want to keep you comfortable. Our nurses are pain experts to the point that sometimes the doctors are even calling them and saying, what would you do with this type of pain if they have certain patients? And but it's a compassionate type of care that you get. We care about you as a person, as our patient. We care about your family that is going through the issues that they're going through, the grief issues that they may be going through. All of these things come together to make things better for you because you can get along with your, unlike home health, that home health says, well, if we're going to come in there, you have to be at home. You want to go somewhere in your own hospice? If you feel like it, we tell you to go. We'll take care of it. If you're going to be out of our area for a while and you need to know that you've got a hospice somewhere else to take care of you, we contract with another hospice in the area you're going and say, okay, they're going to be here for this long, we're going to let you go. We prefer to have our patients that 6 months out instead of just a few days or weeks or whatever, because we get to know you better. We've had one patient several years ago, chose not to have any treatment at all for the cancer they had, loved to go golfing. You know what? We had a nurse that liked to golf, so she would go see the patient, take them to the golf course, hit as many balls as they could, and then came back. That's what we do at hospice. So how do we qualify for hospice? Well, number one, you have to have something that the doctors say is probably going to kill you within the next 6 months. That could be cancer, that could be lung problems, heart problems. We have multiple things that could qualify you. But we do have to have a doctor saying that if the disease progresses as it should, or as they expect, then you have 6 months or less. We do have ever so often people that we say graduate from hospice. We had a gentleman one time, we had him for over a year. Finally said, look, you're not declining anymore. We're going to discharge you. So he went another couple of years and then came back to us and actually died in hospice. But we do have those that get better or stabilize to a point. We don't come in and take away all your medications. You're in control. And that's what we all want. We want to be in control. So that's one of the things that we can do. So who makes a referral for hospice?
Doctor.
Doctors can make a referral, but family members can make a referral. You can make your own referral. You can say, we do have to have a doctor that says, yes, this is what I think, but as far as talking to us and having that referral, anybody can make that referral. If you just want to talk to us and find out about what hospice is, you can do that. And there is no charge or anything for you doing that. A lot of times what we have is patients go, well, what happens if I go on hospice? Some of the questions that we have are, can I still see my doctor? Your doctor will remain involved if you want them to in the case, but you don't have to get back out and go see the doctor every time. If something's going on, the nurses are out there, and if there's something that they feel like needs to be changed or there's a question, they call the doctor up and say, hey, we're not keeping them comfortable. We think we need to do this. Or can you suggest for us what it is? And a lot of times they prefer our suggestions, and the doctor will either say yes or no with our suggestion. If he says no, then okay, what do you suggest? And we'll do your suggestion. But we do keep the doctors informed, but you don't have to go back and forth to the doctor. Some people want to know, can I go to the hospital? Normally you don't, because our nurses are your emergency room on wheels. Isn't it so much better for you to be able to be at home and call 24/7 and be able to talk to a nurse? And if you need somebody to come out, then they go out. So most of the time you don't end up in the hospital. However, if you decide that you want to, you have the right to fire hospice and go back to seeing your doctors and going back to the hospital if that's what you want to do. Oops, sorry about that. What happens when your loved one dies at home? With hospice involved, you call the nurses. They take care of calling the funeral home, they take care of taking care of the patient, they take care of everything, and you have to do nothing else except go to the funeral home afterwards. However, if your family member dies at home without hospice involvement, then you have to call the coroner and make sure that they come out before anything can be done. So the Anna Mayo and Hospice House is a very nice place. If you have not been by and looked at it and seen it, I encourage you to come by and just say, hey, I would like to have a tour, because it is very nice. We only have 6 beds, which sometimes is, we have more people wanting to come in than we have beds, but knowing that we can take care of you at home, in your own home, helps a whole lot. The facility was opened in October of 2016. We provide pain management, emotional and psychosocial support, spiritual support for families and caregivers. When you're on hospice, all your medications that are required for your terminal diagnosis is included in the hospice care that you get. If you're at home or if you're at the hospice house, the equipment that you need is included. Any nutritional supplements, sometimes you have Boost or Ensure or something like that that you like, we provide those. If you have a wound, we provide the dressing supplies and those kind of things. So what happens is that you're not having to go out and get a lot of other things that you were having to go get at some point, because we supply that. We also you also have somebody to talk to about end of life. What's going to happen? Is this what's happening? Is that what's happening? We have volunteers. Our volunteers go through a training and a background check and a drug screen just like all of our employees do. Our volunteers can come out and allow the family members to go run errands, to go to doctor's appointments, different types of things, and they can be out there anywhere from 2 to 4 hours, 2 to 4 days a week for 4 to 8 hours in that total week. So, you know, we want it to be what you need and what you want. There's also bereavement follow-up. We are required to follow up for 13 months after a patient's death with the family member. So you'll still have some contact with us. Most of the time it's mailings, but we are available to help with that grief support that you may need. So those are the things that we can provide. The levels of care at the hospice house, we have a high level of care. We call it general inpatient or GIP. What that means is that the patient comes in, their symptoms are not controlled, their pain's not controlled. Medicare pays us the highest dollar amount. Medicare pays us on a daily rate, but for those people that we need the extra support with, then we get paid the highest dollar. There is no room and board charge with that. You can come to the hospice house for those 3 to 5 days without having to pay anything. But when the respite care is another thing that we have. Respite care is 5 days at the hospice house. I have to warn you though, if you bring a loved one to the hospice house for 5 days, we are going to spoil them. I'm sorry. That makes it harder sometimes on the families when they go back, but we do love to spoil our patients. But it's a 5-day respite that is allowed by Medicare, and Medicare pays for that. And then our routine home level of care is the same level of care at the hospice house, except that there is a $200 a day room and board charge at the hospice house. And the reason for that is we don't pay your electric bill when we have patients at home. We don't buy your food. We don't take care of your rent or any of those things. And we don't get paid any more when they are at the hospice house than we do if we're coming into your homes. Medicare pays us at that same rate. So we have to charge that room and board rate to help us get back some of the fact that you have 24/7 nurses and aides available. And you get 3 meals a day if that's what you want. Talking about how it's paid, I said Medicare paid it. Medicare Part A has a hospice benefit. They pay us on a daily rate according to what level of care we have determined that you're on. Most of our patients are on the routine level of care. However, like I said, if they come into the hospice house, we can have that. If you come in for respite, then that's giving the family members a break. But if you don't have Medicare, Most of you do. Medicaid or a private insurance pays very similar to what Medicare. They usually go by the Medicare guidelines on how much they're going to pay us. So we have seen that. So do we have any questions about hospice? Yes.
I got two quick questions.
Uh-huh.
If you have a family member on hospice and they're at home,
Mm-hmm.
and the nurse or volunteer, whoever it is that comes out to the home, will it always be that same person, or do they just?
Okay. Our nurses, we have 3 full-time nurses, and we have 2 or 3 PRN nurses that go out into the homes. We usually like for everybody to see a new patient, just because they're all taking call, and whoever's on call at least has seen the patient before. But other than that, you usually get 1 or 2 that are kind of in there the most. Volunteers, on the other hand, what we do is we assign a volunteer to that family. That volunteer works with that family from the time they start with the volunteer until the patient is gone. You don't have...
Patient
Right.
builds up a relationship.
Right.
The second one is who you mentioned that Medicaid and all that pays for, but is there any actual pay from the patients to hospice?
The only actual pay would be if you come into the hospice house and stay and have that $200 a day room and board. There is a small copay. Right now it's running about $40 for the 5 days of respite. Yes?
If you only have 6 kids, somebody go into there for 5 days for rest?
We usually have try to keep at least 1 bed available for respite patients. We keep 2 available for GIP patients if we need it, and we do have patients that come in and stay there, but there's only 3 of those beds that we have set aside for that. Yes?
Like hospice, how many beds do you have? How many patients do you have at one time?
We only have 6 beds there. So 6 is our limit on patients at one time. But like I was saying, we try to keep those set. If we have somebody staying long-term, paying the room and board, then we only have 3 beds that we have set aside for that. We have 2 beds set aside for the highest level of care in case we have patients that need to come in and out there, and 1 set aside for respite. Yes?
Do you have a waiting list?
Not right this minute. We can have. We have had before, but right this minute, no. Somebody else. Yes?
I just want to be sure I understand. If the patient goes into your facility, there's a $200 a day charge. That's billable to the patient, or who pays that $200?
That is billable to the patient.
Okay, so then if they get care at home,
If they
those
get,
services are paid for by Medicare.
right. Yes. And the reason for the $200 a day, and it depends on the level of care, but the reason for that is that we get paid the same to go into the homes as we do to take care of them there at the hospice house. Yes, ma'am. You're talking about long-term care insurance? Long-term care insurance, a lot of times we'll pay it. You have to look at your policy and make sure exactly what it says. Medicaid, on the other hand, does not pay for the hospice house. Anybody else?
I have a comment.
Okay.
My mother and my husband volunteered with hospice and got excellent care from the nurses.
Thank you for that comment.
Really appreciate
Mhm.
everything.
Yes, ma'am.
My aunt was in the hospice house, and it is better than a 5-star hotel. It's wonderful. The nurses were so kind and wonderful with the family as well. well as the patient.
Thank y'all.